Welcome to all of you. My name is Mark Stephenson. I have been serving on the Pathways to Promise board since 2006, and it's a tremendous honor to be able to be part of this ministry that serves congregations, faith communities across the United States in helping those faith communities minister effectively with people with mental health challenges. And today we're pleased to have Dr. Steve Grcevich join us for this webinar, and it's being recorded, so you'll be able to share the link at some point with others who haven't been able to join us. I probably don't need to introduce Steve because most of you know who he is, but I have this introduction, and so I'd like to read this for you. Dr. Stephen Grcevich, MD from Northeast Ohio Medical University, serves as the president and founder of Key Ministry. He serves the primary vision caster and spokesperson for the ministry and plays an important role in Key's efforts to develop collaborations both within and outside the disability ministry movement with church leaders, other like-minded organizations, and the professional community. Dr. Grcevich is a regular contributor for Moody Radio Cleveland and the Ethics and Religious Liberty Commission of the Southern Baptist Convention, and is frequently invited to speak at national and international ministry conferences on mental health and other disability ministry-related topics. His first book, Mental Health in the Church, was published by Zondervan in February 2018. In addition to his ministry work, Dr. Grcevich is a child and adolescent psychiatrist who combines nearly 30 years of knowledge gained through clinical practice and teaching with extensive research experience evaluating medications prescribed to children and teens for ADHD, anxiety, and depression. He serves on the faculty of Northeast Ohio Medical University and Case Western Reserve University School of Medicine. He's been a presenter at over 35 national and international medical conferences and is a past recipient of the Exemplary Psychiatrist Award from the National Alliance on Mental Illness. And NAMI, of course, as many of you know, is a good friend of Pathways to Promise. So Steve, thank you so much for joining us and welcome.
Well, Mark, Jermaine, thank you so much for the gracious invitation to join you today. Pathways to Promise does wonderful work, and we've been delighted to get to know Jermaine and get to know a little bit more about what you folks have been doing, through some of the things that the federal government's been coordinating around helping churches and other faith-based organizations support families impacted by mental illness. So a little bit about how I got interested in this particular topic. 22 years ago, I was serving on the elder board at our church when we had a number of families from the church who were very dedicated, highly committed folks who went to Russia and Bulgaria and had adopted kids from orphanages there after the fall of the Iron Curtain. And a lot of these families were struggling greatly in terms of being able to attend worship services, maintain their service commitments, stay involved with a small group because of the challenges that were presented by the kids that they adopted. So I'm sitting there listening to this and went back to our practice, and over roughly a 3-month time, we were surveying our established families, and we asked them, one question when they would come in for follow-up visits, which was, did the problems that brought you to our practice impact your ability to stay involved at your church or place of worship? And I was floored by some of the things that I'd heard. And so we had ultimately ended up starting Key Ministry. This is 17 years ago. And our original focus was on helping churches minister with families of kids with quote unquote hidden disabilities, of which, mental illness is, the predominant condition that would fall under that category. And so, as time went on, because of some of the various things that we did, there was a big movement in the church, probably began 10 to 15 years ago, where people were recognizing the struggles of families impacted by autism. Thanks to the work that the folks at Johnny and Friends had done, churches made great progress in terms of welcoming folks with physical disabilities. We were doing well in conjunction with the Peace with Autism, and there were a number of organizations that formed to help churches, include and serve persons with intellectual and developmental disabilities. But because 75% of all disabilities that we see in kids are mental health related disabilities, that was an area where there appeared to be a giant void. And so that a lot of the work that I've been doing in connection with our ministry in the last few years, is to help churches to develop, an inclusion model or strategy for being able to welcome families that are impacted. Because part of the reason why I think churches have struggled with this is that there wasn't a specific model in the same way that there is with special needs ministry for them to follow if they want to go ahead and get something started up. And about a year and a half ago, there was an interesting study that came out that I think dramatized, the extent to which, having a mental health condition becomes a problem in terms of church attendance, and church participation. So Andrew Whitehead's a sociologist from Clemson University, who interestingly enough has 2 sons on the autism spectrum. And one of the things that he did was that he evaluated 3 different waves of data from the National Survey of Children's Health. And so this is a large survey that the federal government does roughly every 2 to 3 years, where they do phone interviews with approximately 100,000 families around the United States. And so this would be the study, like when you hear about like the statistics about like the prevalence of autism, this is where a lot of that data comes from. And so it turns out one of the questions that they ask as part of the National Survey of Children's Health is, did your family attend a church or place of worship at any time in the last year? And so what Andrew did is he went back through and he looked at the correlation between having a child in your family with specific types of disability and the likelihood that they attended church or a place of worship. And here's what he found. And so I don't think it's a surprise to anyone that having a child in your home with autism makes it 84% less likely that that family would have attended a worship service in the past year. But take a look at some of the other conditions up on the screen. After autism comes depression, traumatic brain injury is high on the list. But you look at some of the other stuff, conduct disorder, anxiety disorders, ADHD, and by far and away, mental health conditions are the disabilities that are most likely to keep families away from church. You take a look at some of the conditions that weren't associated with lower church attendance. Tourette's disorder, epilepsy, hearing or vision problems, cerebral palsy, intellectual disability. Like a lot of the things that we have typically thought about, as sort of forming the crux of special needs ministry. I think that this just calls attention to the fact that, families who are impacted by mental illness are an enormous underserved population for the church. And this is a population that is literally like, sitting right outside the front door of, churches all across the United States. And so one question comes up, like when you take a look at like data that Dr. Whitehead presented, why would it be so hard for people with some of the common mental health conditions that we described? Where you're looking at, depression, anxiety, ADHD, other mood disorders to be part of church. And a way of thinking about this is that there are certain attributes that are associated with common mental health conditions that make it more difficult for people to be part of church. And this also clashes with certain expectations that we have for how, for how folks are going to act, for how folks are going to interact when we gather together for different activities at church. And so like you think about like some of the things that would get in the way potentially. The first one is stigma. And interestingly enough, there was about 5 years ago, there was a large study that Lifeway Research did with focus on the family looking at issues related to mental illness in the church. And one of the things that they had found was that 55% of adults who don't regularly attend church believe that people with mental illnesses aren't going to be welcome. Second issue, and this is probably, at least for what I see with, with kids and teens, one of the largest issues is anxiety. And well, again, this is a gross oversimplification. One of the things that we found through various neuroimaging studies is that people with anxiety oftentimes struggle with overestimating the degree of risk entering into new or unfamiliar situations. For example, you have people, 1 in 15 kids and adults in the United States struggle with social anxiety. And folks with social anxiety tend to make lots of false assumptions, or they overestimate the risk that they're being judged or scrutinized by other people. And you think about someone who's, intensely uncomfortable because of that new social situations. You think about how hard it would be for them to visit a church for the first time. That's a major issue. The third is self-control. That there are specific scriptures that associates self-control with spiritual maturity. But if you happen to have a mental health condition that negatively impacts one's capacity for self-control, folks oftentimes start making certain assumptions off of that. And shortly after our church had started their inclusion ministry, we did Disability Sunday, and there was a couple who was asked to get up and give their testimony, and they had they talked a little bit about their experiences of what it was like trying to find a church in suburban Cleveland when they had a 7-year-old and a 5-year-old son, both of whom had fairly severe ADHD. And the comment that the mom made during the service was that people in the church think they can tell when a disability ends and bad parenting begins. And so that, for families who have kids, particularly like kids with disabilities where, again, it's less obvious, or you wouldn't be able to capture that in like a still photograph of a child. A kid with ADHD, a kid with autism, a kid with fetal alcohol or drug exposure, or kids who've been exposed to trauma, where that impacts the pathways in the brain that are involved with modulating self-control. Folks will come to a church and oftentimes feel very much judged by other people. A fourth issue, and this is something we think about a lot with people on the autism spectrum, but there's a growing body of research to suggest that this is a big issue for people with anxiety as well as people with attentional disorders, is sensory processing. In a lot of our churches, the bright lights, the volume of the music, the reality that, like, coming and going from church, you might hear 15 or 20 different conversations within 20 feet away. For folks who have sensory processing differences, entering into some of our large group environments, especially around worship, can be something that's very overwhelming and at times very distressing. Like a fifth challenge is social communication. So if you have a mental health condition that impacts on your ability to accurately process and perceive social cues, the tone of someone's voice, the inflection of their voice, to be able to stay attentive to them while they're talking to you. With churches being intensely social places, those kinds of deficits associated with a number of mental health conditions become very challenging. The sixth barrier is social isolation. And one of the challenges that we see is that in the case of children and teens, a lot of times if families have a kid with a serious mental illness, it becomes very socially isolating. Their kids are less likely to be involved in sports and the other kinds of extracurricular activities, that consume so much of the time of, like, many of the kids in our country right now. One of the things that's an issue is that parents have a hard time finding babysitters or childcare. So they're less likely to go out and socialize and to interact with, like, their friends and neighbors who would potentially be in a position to be able to invite them to church. You think about, again, folks with social anxiety, folks who are experiencing symptoms of depression, folks with, like, folks who have other major mental illnesses. withdrawing from other people is a common symptom associated with those conditions. And so, all of those things, make it more challenging for folks to be part of church. And then the final thing that we oftentimes have to overcome is that a lot of the families that we would encounter, where this is something that they're wrestling with, they have to overcome past negative experiences of church. Or one of the things that I learned like about 30 minutes into my like child psychiatry fellowship was that the apple doesn't fall too far from the tree, and that kids with issues oftentimes have parents with issues. And so if this was something that mom or dad struggled with that kept them from being a part of church, it's highly unlikely that they will then make the effort to ensure that their kids become part of a church. And so one of the questions that came up early on is, well, why wouldn't the typical kinds of like ministry models that we use to serve folks with quote unquote special needs not work with this group?
Steve, if I can interrupt just for a second here,
yeah.
This is great information, and I'm wondering, as people are listening, they may have questions that come to mind. So I just want to explain to all the participants, if you hover your cursor toward the bottom, you see a little a balloon, a chat balloon, and then the word chat. Just click on there and type in your question, and then after Steve's finished, then we can go through your questions.
Okay. Right. Well, yeah, thanks for going ahead and adding that, Mark. So a couple of things that one has to think about, because there's a different level of stigma associated with mental illness than there are with, say, like, intellectual disabilities or autism or other kinds of, physical disabilities. People aren't going to self-disclose. So that whatever kind of strategy you come up with to serve them, it can't be something that's dependent upon knowing about a person's diagnosis. Confidentiality is a big concern here, in that, I know that those of you who are involved with church, I'm sure that you've never experienced instances where people gossiped about things at church, and so that, again, oftentimes, if you're talking about, you're talking about an adult, I mean, there've been, a number of things written about like the stigma associated with this in terms of even pastors seeking out help. How much more reluctant would individuals or somebody who's just, looking to attend a church or looking for a church, be willing to self-disclose. The larger issue here that I've seen with like the kids and teens that are, where we help other churches to be able to serve them, is that the kids and families and the adults I know with mental health concerns, what they most want more than anything else is to be able to blend in. And the last thing that they want is anything that calls attention to them as being different. So that, I think about this, kids with common mental health conditions, kids on the high end of the spectrum, being put into something or categorized, in a ministry that serves folks with special needs, they will flee that. And so again, the goal here is that what they most want is to do all of the stuff that everybody else is doing. And so that when we start thinking about it, when we're working with churches around developing a mental health inclusion strategy, that's very much the focus. How do we get them involved with, how do we get them to regularly attend worship services, to be involved in Christian education, to be involved in different ministries of the church where folks are involved with serving other people. So again, that this is very much a mindset as opposed to a program. And it's a way of thinking as opposed to something that would be considered a standalone ministry. So part of what we want to do is we want to get folks who are involved with church leadership, serving, serving in a specific area of ministry. Part of what we try to do is we try to get them thinking about what are some of the things that we might ask people to do who have common mental health conditions that would be hard, and then identifying some of those barriers and proactively trying to, getting them to think about, minimizing or removing all of the things that would be potential barriers. For folks who are interested in, all of this sort of step-by-step in a very detailed fashion, About 2 years ago, our ministry released a book called Mental Health in the Church that puts forth the entire model. Folks would also find we have a series of about 12 to 14 videos on our website that are approximately 10 minutes in length that go through step by step, identify all of the common barriers, and talk about some of the strategies that different churches have used, to be able to overcome those barriers. So one question that comes up is, what does a church look like? Or like if someone were to call me and, if they were to have like moved to town or a particular city, and if they were looking for a church, what are some of the kinds of marks that we would look for that would suggest that it would be a welcoming place and that folks with different mental health conditions would, be readily, accepted, included, and able to participate in the broad range of ministries and activities offered by the church? So here are 5 characteristics that we would look at if we were putting together some sort of a directory. The first is that the church is involved with some sort of an intentional mental health inclusion planning process. The second piece of this is that the church would take steps to educate their staff and key volunteers on key ideas and important things to know about folks struggling with mental illness. So I know that like one of the things, for example, that I know Jermaine was in on the ground floor with was developing training for mental health first aid. So that's one of the things that we have seen like more and more churches that we're working with, embrace and ensure that their staff members get that type of training, especially folks on the front line who are most likely to interact with people who are in some sort of a crisis. We're seeing more and more churches become intentional about being trauma informed and understanding like all of the impacts that might have, on someone's mental health concerns. This is a very pressing issue for us, particularly when we start working with churches that are involved with a lot of adoption or foster care ministry. That understanding the impact of trauma becomes very important there. The third piece is that the church is actively involved in developing some sort of a mental health communication strategy. And I think about, for example, the church that we were working with here this past year in the greater Cleveland area. One of the things that they did that was absolutely fabulous when they were kicking off their strategy is that the guy who was the founding pastor of the church made a Facebook video. It was about 5 minutes long. It was specific to something to put in the hands of people who were attending the church. They went ahead and they bought some advertising to make it more visible. And the video started off, saying, hi, I'm Rick, the founding pastor of the church, and I want to make it clear, to our friends and neighbors that people with, mental health concerns are welcome at our church. My father was a pastor. He struggled with depression. We understand like what some of the challenges are, and we're here prepared, to be able to welcome you. One of the things that their church had done, is interesting. You go back to the Lifeway study that I had referenced before. When they surveyed family members of adults who had major mental illness, schizophrenia, bipolar disorder, major depression, and they asked them what they most wanted from their church, the number one suggestion is that they wanted their pastors and church leaders to talk about mental illness from the pulpit. That by doing so, it greatly destigmatized the topic and folks feel more free and more comfortable to be able to self-disclose with other people. So the church that we work with in Cleveland, as part of their strategy, they actually did a 5-part sermon series this past fall on, what does the Bible have to teach about anxiety and managing anxiety? They did a video that they shared in their different services where one of the leaders in their worship band talked about their own struggles overcoming panic disorder and agoraphobia. So that the whole communication piece is important in terms of letting folks know internally that it's safe to be able to disclose your mental health concerns to one another. It is also critical in terms of changing perceptions in the larger community as to whether people will be welcome with mental illness. The fourth piece is that we look for churches that are offering practical help to individuals and families who are affected by this. About 3 or 4 years ago, our most popular blog post was entitled, "We Had No Casseroles." It was based off of a segment that was done on 60 Minutes where they were interviewing parents of teens in the state of Virginia who struggled to get access to mental health care. And one of the moms on this, on the 60 Minutes segment had commented that when their 13-year-old daughter broke her leg in a skiing accident and needed surgery and was in the hospital for a week, every night of the week, someone from the church brought food or a casserole, and there was very tangible help to support the family during that kid's hospitalization. 6 months later, when she overdosed and got admitted to a psychiatric hospital, there were no casseroles. And so like little practical things like that make an enormous difference, to folks who are struggling with these conditions in terms of feeling like they're cared for. So some of the things that we see churches do, providing free respite care to families of kids, with mental health struggles. Having a current up-to-date referral list of resources, professional resources and clinical resources in the immediate community for folks to be able to access who approach the church for help. Those types of help that meet like very real immediate needs, very much help people to feel valued and welcomed and included. And then the last piece is that there are a couple of organizations that we work with very closely. One is called Fresh Hope. The other is the Mental Health Grace Alliance, where there are now national networks of churches that are offering biblically based, Christ-centered support group models for teens and adults who are struggling with mental illness. And so that we encourage places as part of developing an overall strategy to think about the role that those groups might have in terms of supporting people already in the church and welcoming people who have struggles who are currently outside of the church. So those are some of the things that we have seen folks do successfully. Part of what our ministry is available to do is that we provide all kinds of free training, consultation, resources, and support to churches that are looking to develop a mental health inclusion strategy, as well as churches involved with any type of disability ministry. We put on and host the largest disability ministry conference in the country, Inclusion Fusion Live, which will be April 24th and 25th in Cleveland. We are delighted that Jermaine is going to be one of the presenters at that conference. And for churches looking to do a deep dive into mental health ministry, becoming more trauma informed, or even developing in general special needs or disability ministry, we would very much like to meet with you in Cleveland. We have all kinds of video training available for free on our website and on different web platforms, including Vimeo and YouTube. We host regular disability ministry roundtables, some of which have a very specific mental health focus. And so I would encourage folks who have like additional questions or needs to come to www.keyministry.org. We have, we make it easy to connect. We make it easy for folks to be able to access resources. So that if there are additional services or supports or questions that your church may have afterward, we would be delighted to help you. The lovely woman pictured on the screen is Katherine Boyle. She is our mental health ministry director. So you can email her directly at Katherine@keyministry.org. I'm Steve at keyministry.org. And again, that, alongside, working together with, Jermaine and Mark and the great people you have, we would be delighted to do whatever we can to help your church think about, how you might better serve families that are impacted by mental illness. So thank you.